Confronted by pervasive poverty and declining health standards, Kenya as a country developed the Vision 2030 that proposes the social, economic and political pillars that must be strengthened for the economy to grow at the projected rate of 10% per year. Besides this national blueprint, Kenya is also a signatory to the Millennium Declaration and committed to health MDG, namely reduction in under 5 mortality by 2/3 by 2015, reduction in maternal mortality by 3/4, and halting and reversing the spread of HIV/AIDS together with the attendant opportunistic infections. The progress towards meeting the MDG has been slow, thereby jeopardizing the attainment of improved health status and poverty reduction. As the main player in the healthcare sector, the government, through its twin ministries of health, has developed a network of health facilities distributed nationwide that makes it the single largest provider of healthcare services in the country. However, the civil society and the private sector are a significant source of healthcare to all. In the light of this, and in the course of time, there arose the need to harmonize and rationalize the operation of non-state health service providers. This realization is what necessitated the formation of HENNET.
Civil society was also very disorganized and coordinated, so it wasn't just government that didn't have stewardship. The civil society also, that was providing almost 50% of the services, did not have coordination and stewardship and a common voice and a common place where we could push agendas that were key.
HENNET was found and seen to be one of those, an avenue through which the civil society could come together, articulate their needs and the issues that they wanted to place before the other important partner, which is government, for absorption in the policies and programs.
We identified very specific quick gain activities, and the first one was really to build the credibility of HENNET in the ministries of health, top level, from the permanent secretaries to the health sector coordinating committee, and among then they were called health donors working group. That was our very first assignment. How do we make them accept us? How do we make them think we are not any other NGO coming here to just point fingers and make them believe that we want to work with them?
Since its inception in 2005 as a coalition of civil society organizations in the health sector activities in Kenya, the Health NGOs Network, in short, HENNET, has since worked towards bringing the entire health sector community service organizations under one umbrella. The initiative is aimed at ensuring that organizations with diverse backgrounds, both national and international, are brought together for the purpose of working towards achieving a common objective in line with the network's vision of a healthy Kenyan society.
When HENNET was being formed, that was also the time when a code of conduct was developed in the health sector. And it was negotiated between the Ministry of Health and the donor group. And we came in and said, now we are partners. We should sit around the table and negotiate, and we should be a partner like the donors in the code of conduct for the health sector. And we managed to get in there, and I was negotiating that with the then coordinator and together with the faith-based organization. That was a real victory.
We did not have a forum where we could meet together with the civil societies. That's when the idea of having HENNET came around, and the government actually strongly supported HENNET being formed so that we could talk and engage with the civil society.
In a continued effort to fulfill its mandate of stimulating linkages and creating strategic partnerships among NGOs, government and private sector for increased positive responses towards the health needs of Kenyans, HENNET program of activities revolve around four main strategic objectives, that is, information sharing, advocacy, capacity building, and networking. On information sharing, the network fosters sharing of knowledge, skills, research findings, best practices, and lessons learned among its members. Advocacy on issues affecting healthcare systems in Kenya, such as greater allocation of public funding and equitable access to affordable healthcare services, are at the core of HENNET's functions.
When HENNET speaks, it is like it's speaking for the civil society. When we push for any agenda, we push it together in a coordinated form as a civil society.
On capacity building, HENNET designs and carries out this exercise, usually based on the needs of its members and the assessment of high-quality training available in the market.
When we receive the updates or any input that is required from us, then what I do as the contact person is to also circulate and get input from the staff within the organization. If there is anything also, an update that is good for our field offices, for any other staff within the organization, I share it out.
HENNET comes in handy in terms of making sure that our members are informed about the sector engagement processes, any new schemes that are coming up, any new policies that are coming up, how do they participate in it, and gives them more information on how they can be able to participate.
Indeed, HENNET was established to bridge the gap that existed in terms of coordination between the state and non-state healthcare service actors. Initially, there was no single voice that spoke and represented CSOs in the health sector, despite the fact that NGOs and faith-based organizations are important providers of Level 1 and Level 2 services.
Sometimes you find that the hospitals or the facilities that are available in certain areas, especially hard-to-reach areas, are basically HENNET or faith-based organization.
In its mission statement, HENNET endeavors to stimulate linkages and strategic partnerships among health NGOs, government and private sector in order to enhance their responses towards health needs of Kenyans. To this end, HENNET carries out its functions in line with the following objectives: articulate health needs and promote efficient and effective allocation of health resources, share knowledge, skills, research findings, information, best practices and lessons learned among NGOs, government and private healthcare providers, articulate and address challenges and constraints affecting health NGOs, government and private providers, support health NGOs in their advocacy role in critical issues affecting the health of Kenyans, coordinate NGOs' health activities so that they are in line with relevant national health policies and procedures, actively participate in development and implementation of national health plans and policies, build alliances with other health networks, both national and international levels, build capacity of the network's members in areas of need, and mobilize resources for HENNET Secretariat. Therefore, partnerships between the public and private sector has emerged as an attractive policy option in recent years. As a consequence, the current debate favors greater private sector involvement in health.
There is certainly a willingness to engage in public-private partnership in Kenya. So I think HENNET forms a useful tool for that in terms of the voice of generally private, not-for-profit, and also a little bit the for-profit sector.
In order to fully and effectively discharge its obligations, HENNET has formed partnerships with many development partners, among them UK Department for International Development, WEMOS, German Development Corporation through GIZ Health Sector Program, United States Agency for International Development, Academy for Educational Development, development partners in health, World Health Organization, and Quad Aid.
The German government, through GTZ at the time, now we are GTZ, funded HENNET since 2006 until 2009, I think. And I think in the initial phase, say the childhood of HENNET, we provided almost 50% of the funding of HENNET.
On the other hand, HENNET has continued to receive key financial and administrative support services from AMREF in line with an existing MOU between them.
We started simply by inviting major NGOs and FBOs that was working in health, national and international. Once we know who we saw, in the arena from the various work we are doing, both in the field and at the national level.
It is on the account of partnerships that HENNET has been able to develop its operational structures. For instance, the network benefited from an institutional strengthening workshop supported by AED, Capable Partners Initiative.
2008, 2009, that USAID actually started working directly with HENNET. With the end of the German support through AMREF, we agreed that we would want to help build the capacity of HENNET as an organization.
On this score, HENNET's operational strategy for year 2007-2010 clearly identified its management structure to reflect its mandate. Here, the annual general meeting is a supreme decision-making organ that ratifies all key decisions taken by the board. The Secretariat, on its part, manages daily operations of HENNET under the guidance of the Executive Committee.
We have the director who sits at the head of the Secretariat. Then we have program officers who are supporting the different functions of HENNET, which include networking, making sure that we network with our members and give them information on what the network is all about. Then we have advocacy officer, who is generally in charge of what are the advocacy issues that HENNET would like to address. Since last year, we now have an M&E officer who's able to monitor and see where are we going. Are we able to look at the programs that we have implemented and the direction that they are taking? Then in terms of support functions for HENNET, we now have an assistant accountant and one officer who supports our administrative functions.
I think it has surpassed my expectations because I think even the chair, because we had thought in the beginning it should just be a small secretariat of 2 people, just bringing the NGOs and the ministries together. But we realized when we got into it, we realized there was so much that was needed that we hadn't realized. And as you can see now, the network has a personnel of almost 10, and everybody has a role to play.
With a membership of health NGOs that is fast growing and now standing close to 90, HENNET has built a critical mass that is involved in different aspects of healthcare service provision depending on each member's mission. It is notable that HENNET's member organizations continue to come up with innovative ideas in the provision of healthcare services to Kenyans. Ever since its formation in 2005, HENNET has been a voice for members within the health sector processes and decision-making. In this regard, the network supports member coordination and alignment to the Kenya Health Sector Strategic Plan through capacity building and information sharing in pursuit of a healthy Kenyan society.
I think the next couple of years are going to be very interesting with devolution and some of the constitutional imperatives to the right to health. And I think HENNET's role is going to become probably even more important as the interface between government and between the donor organizations and between people on the ground. How are we going to implement the right to health? What does that mean? And I think HENNET has an important role to play in monitoring what's going on the ground through their member organizations and maintaining a dialogue between people on the ground, implementing partners, and government and donor organizations.
We are known now at national level in the health sector, but if you go to district, you will not necessarily have a HENNET that's known or a district medical officer of health that knows what HENNET is all about. That's where I want. I want on county, the whole county setup. You know, HENNET should play a role in coming up and say, we think that health should be delivered and governed in ABCD ways at the county level. And every county should know, go to HENNET if you want to know civil society and what they're doing. That's how I would like to see HENNET in 3 years' time.
A long journey, they say, starts with one step. And HENNET has, in the past 6 years or so, made great strides and seems to be determined to make the long journey in providing leadership in the health sector. This can be seen in our recent and ongoing programs, such as the rollout to provincial and district launches and sustained capacity building initiatives that are mainly carried out through the network's district focal points. Despite the phenomenal growth in HENNET's membership and capacity, the ever-increasing needs in the health sector and achievement of the MDG and Vision 2030 still pose immense challenges. These cannot be surmounted single-handedly. Therefore, HENNET will still need both human and financial support in order to enable her to meet her strategic objectives in keeping with the network's vision and mission.